With stunning advances in medical research converging with emerging technology, the future of healthcare can seem like it's straight out of a science fiction movie. Joining me to explore this topic even further is Futurist Shara Evans. Great to have you with us.
Thanks so much, Miranda. This is such a fun topic to talk about.
Tell me about artificial intelligence. This sounds super sci-fi.
Oh, it does sound sci-fi, but work on our AI started all the way back in 1956. So it's not quite as sci-fi as you might think, but it's accelerating in leaps and bounds right now. So when I talk about AI, I'm talking about machine learning, deep learning, chatbots, image recognition, facial detection, emotion detection, all kinds of image recognition, robots, driverless cars, you name it. The spectrum is huge. But in the medical field, there are a couple of really, really exciting things happening. The first is that with AI, using technologies like machine learning and deep learning, they're able to absorb these massive, massive data sets and look at patterns and detect things that humans simply cannot because of data overload. So one of the things that is really challenging from a pharmacy perspective, medical perspective in general, is understanding the different side effects of drugs when you combine them together.
Interesting.
So if you start taking, one drug at a time, we know the side effects.
Yeah.
But if you take 2 drugs at a time,
Yes.
or 5 drugs at a time, it gets more and more complex, and you can have some unintended consequences.
Yeah.
And there's a lot of work happening in this whole field of doing modeling using artificial intelligence to look at what these potential side effects might be. And when you look at the 5,000 plus drugs that are out there and the 1,000 plus potential side impacts, there are over 125 billion potential combinations of things that could happen.
Right. My goodness.
So using AI, they're starting to develop techniques to help understand how the interactions of 2, 3, 4, 5 drugs will interact on a particular individual. It's really incredible.
It is fascinating.
And there's chatbots too that are medical grade chatbots. So you and I are having a conversation right now.
Yeah.
And imagine if you went to your doctor, you'd have a conversation with him and her. I'm not feeling so good, I've got a tummy ache. He or she would ask you a question and you drill down and drill down. There are now chatbots that talk to you in natural language that ask you the same kinds of questions that your GP would ask you and help determine whether you actually need to see a human doctor, whether you need to go to the hospital, or you just go to your pharmacy and ask for a particular type of remedy. And more, as you go into the pharmacy, you'll have clients walking in saying, I was just talking to my AI, and my AI said I need such and such and so and so. And pharmacists are going to be hearing this more and more and more. And that is just the tip of the iceberg with artificial intelligence.
Essentially, what all of this comes back to is better patient care.
Absolutely, and very personalized, because the other thing that's happening is genetic engineering and sequencing of genomes. And by doing that, we're able to actually look at the building blocks of each of us as an individual. So as we start to understand our own genetic makeup, that means the medicines that are prescribed for us are even going to be 3D printed just for our own specific physiology. And that is going to completely change the whole medical delivery model. And that is starting to happen now with genetic engineering and the whole human genome project.
Shara, thank you so much for your time, and it's so exciting to see how passionate you are about all the innovation that's coming in terms of technology.
Oh, thank you.